Sometimes, things don't always go to plan when having a baby, and you and your baby might need an extra bit of help to make sure your baby is birthed safely. Although you might have a clear birth plan, it's important to be flexible with your expectations.
If your midwife is worried about the health of you or your baby during your labour, then a doctor may advise you to have an assisted birth. You will need to consent to the procedure before it's carried out. This can be for a number of reasons, but it could be that your baby is in a difficult position. There are concerns about your baby's heartbeat, or there are concerns about how your baby is coping with labour.
An assisted birth is when forceps or a Ventouse suction cup are used to help birth a baby. You'll usually have a local anaesthetic to numb your vagina if you haven't already had an epidural. It's also likely that a cut called an episiotomy will be needed to make the vaginal opening bigger, which will be stitched later. A Ventouse vacuum is a soft cup that fits onto your baby's head using suction. During contraction, the midwife or doctor will gently pull on the device to help birth your baby whilst you are pushing. Forceps are a smooth metal instrument that look like large spoons or tongs. They're curved to fit around your baby's head. During contraction, the doctor will gently pull on the forceps to help birth your baby.
Ventouse and forceps are a safe way to birth your baby, but there are also some risks. There is an increased chance of a tear that goes into your back passage. There is also an increased chance of damage to your pelvic floor, resulting in difficulties holding urine, poo, or wind after birth. If this is the case, you'll be offered further support, including physiotherapy. There is also an increased chance of blood clots in your legs or lungs after the birth. You may be advised to have injections to reduce the chance of this. You may feel less mobile after giving birth, as you may need a catheter for a short while, but most women recover very quickly after birth and are up walking a few hours soon after. You will be offered pain relief on the postnatal ward.
Instrumental birth is very safe. However, there is a chance that your baby may have a mark or small bruise, but these usually disappear within a few days. If your doctor is concerned that an assisted birth is not appropriate for you, they may offer and recommend an emergency caesarean birth. It will be necessary to move you from the birth room into an operating theatre for your birth.
Your midwife can talk through your birth events with you and your support person if you would like. They may be able to explain to you why things happened the way they did and can help you understand the decisions that have been made.
If you think you or your support person might be experiencing birth trauma or post-traumatic stress disorder after a difficult birth, then ask for help. We offer a birth reflection service that can help you come to terms and support you through your experience.